Planning a pregnancy. Most women with epilepsy want to have children of their own, just the same as every other woman. Now, we can't say that there's no risk. There's always some risk, and yes, there are some increased risks in women who plan to have a baby. But the risk is generally mild to moderate, not high. And so for most people, there's no reason why they should not consider a pregnancy. It is very important, however, to make sure you go through the right steps. The first thing I always do is I make sure the person has epilepsy. That is, that the diagnosis is correct. The second thing we need to do is to make sure that you are on the very best treatment to control seizures. And thirdly, the question I ask is, are you on the lowest dose that you can possibly take to control seizures? We don't want to be dangerous, we want to be safe. Well, there's a lot to be said for looking at the medications you're taking. And of course, there are numerous anti-epileptic medications, and all of them have a different risk profile, and all of them are different. I'm going to make some generalisations. If we say that everyone in the community has a risk of an abnormality, a structural abnormality in their baby, that would be perhaps 2%, maybe 3% at most. For women who have epilepsy who are on anti-epileptic drugs, the risk is about double that. So it's about 2 times the risk of the normal population. There may be some situations where the risk is a little bit higher. The risk could be as much as 3 times in people who are taking high-dose valproate, in which case it could be even a little more than 3 times, or if they're taking many drugs in fairly high dose. The specific risks for each drug, however, have to be considered. In general, people who have well-controlled epilepsy before they become pregnant can most often maintain that good control through pregnancy. If they are not well controlled before pregnancy, then it's going to be difficult to control it completely during pregnancy. The general rule is that in pregnancy, people may have a deterioration of seizures because the blood levels tend to fall. So therefore, you might have to be prepared to take a higher dose later in pregnancy. Now, what's some other general advice when planning a pregnancy? We always recommend that the folic acid is quite high. So folic acid supplements are usual to be taken for 3 months before conception and for at least 3 months after conception. A good diet, of course, is also important. No alcohol, no cigarettes, keep your weight good, have good sleep, and limit stress as far as possible. I really want to end on a good note, however. Most women with epilepsy have normal babies and normal pregnancy. 90% or more will be totally normal, but it always helps to plan really well.